Giving people an opportunity for some say, for some input, it really leads to better decisions. So I think that was the intent of the comment. On the 30 dB, and certainly WHO, as Carmen's indicated, does have some community noise guidelines that reference the 30 dBA. I believe WHO's reference there is to an indoor level of sound to allow for a good night's sleep. Now, if you take a look at that document in some detail, I think they're making an assumption of a 20 decibel attenuation or reduction from the building envelope, which is probably not entirely accurate. I think is a bit of an overestimate for what you'd actually get, certainly at lower frequencies where building envelopes tend not to be as good at reducing sound levels.
I'll let you go first. Well, I'm deferring to your ability to stand.
My name is Deborah Johnston, and when the wind turbines, by the way, in November, they were engaged, and I couldn't understand what was happening. I know that I'm old, and I know that I have pre-existing conditions, but when something new happens, like all the muscles in my body start twitching, and I've never had twitching muscles before. When I was trying to lie down, or when I got up, I had waves of nausea, and so I phoned the doctor and said, let's find out about that. She went through MRI at the Bradford, X-rays, ultrasound, and could find nothing. She thought I had multiple sclerosis. Well, I don't know how you acquire multiple sclerosis in a month, but the MRI ruled that out. And so I started to do some research, and I asked people at Health Canada for research studies on what happens to people if they live surrounded that closely by wind turbines. And very nice young man, Scott Armour, sent me a whole package of what he said was research material on what happens to people when they live surrounded by wind turbines. None of them had any studies by Dr. Copes. And I've researched the Lancet and the New England Journal of Medicine, and I can't find these research studies that you're talking about. And so my sense of it is that there are no research studies that have been done on human beings living in their own homes. And you know what, I was actually stupid enough to believe George Smitherman about the idea of aging in place. And I built this home so that I could manipulate a wheelchair, walker, everything. The doors are 3 feet wide. It's open space. I put all of my life savings into that home to age in place. And now it's a disaster, not only for me, but quite a few of the other people in my neighborhood. So we formed a group too. We called ourselves the Norfolk Victims of Industrial Wind Turbines. Now, one of the problems with that is we live in a farming area, and you know, farms once upon a time were 100 acres, so there's one house per 100 acres. How many people do you think are affected? The 30 landowners who own the land and who own the turbines don't live on that land. They live in town. They live in Aylmer and Tillsonburg and Delhi. So why would they be influenced by these wind turbines? No, they're not. The immigrant farmers who come to work on the farms, do you think they're going to complain? Not likely. People who rent empty houses, do you think they're going to complain? No, they're not. Because they can just pick up and move. But those of us who put all of our life savings into these homes, there aren't many of us. And therefore, we're expendable fodder. And I say this is a disaster for us, and we need to be compensated by the Disaster Relief Fund of the Ontario government. The Ministry of the Environment needs to take money from that disaster relief fund and get us out, because the sleep deprivation, I can tell you, is horrendous. And in January, this feeling of nausea came over me one day, and I was just about 4 feet from the wall, and I just couldn't control myself. I went head first right into the wall, and for 2 or 3 months there was a head-sized dent in the wall. I was unconscious. I had no idea how long I lay there. I was lucky that my son dropped in to see how I was. What do? We want relief from this. We want you to go into that disaster relief fund, and we want to be recompensed for our life savings that we've put into these homes. And we are prisoners. We're like guinea pigs in cages. Luckily, we can get out of our cages, and maybe it's the wonderful atmosphere of Walkerton, and I congratulate you, the people who live in Walkerton, because I feel fine right now. The buzzing in my head has stopped. My ears popped as I was driving here, and I was able to hear, and I feel very much better now that I'm not there. And I'm going to stay at one of your wonderful bed and breakfasts, because I don't want to go home.
You're here.
So when are you going to do this for us?
We'll move that issue forward. Thank you. Thank you for that positive energy. Thank you.
And if we're not getting any help from the insurer, and the help has from the responsible bodies that allowed these turbines to be built. They should not have been built. What happened to the precautionary principle? What happened to due diligence? And don't blame the politicians completely. The people who are in these ministries as well. Due diligence, not done. Nor was the precautionary principle used. If you don't know, don't do it. Don't give somebody.
You haven't lived on a wind turbine farm. You haven't had this effect firsthand, and maybe until you do, then you can say you're an expert. Because obviously at this stage, I had more experience than you people. Because I've been put through it. And I shouldn't be here because I was gay.
No, but if you would like to move that forward, I mean, I don't need to live
How
on a
many
wind farm
meetings?
to know that something needs to change.
You have to go for a checkup. You go for a checkup and live it. You're a doctor. Do you answer questions over the phone of what's wrong with a person? And are you right? Go live the experience, live the dream.
I do not need to have a disease and experience it to appreciate its symptoms as a physician or as anybody. And I do not disagree that folks are suffering.
Little has been satisfactory until you get off your butt and live the dream, buddy.
Obviously, there's a lot of concern, obviously a lot of contentious issue.